My name is Brianna Roan. I'm a nursing student here at Chamberlain. And this is Glenn Roan. I'll be performing my nasogastric insertion on him today.
I give Brianna Roan permission.
Mr. Roan?
Come in.
Okay. Hello, my name is Brianna Roan. I'm a nursing student here at Chamberlain. Today I'm going to be doing a nasogastric insertion on you. This tube is going to go down your nose and through down your throat. It's going to be used for feeding. Do you have any questions?
No, ma'am.
Okay. If we're in a hospital setting, I will bring your bed up, sitting up to the supine position, about a 45-degree angle, 30 to 45-degree angle. Okay. Do you have any history of any nosebleeds, any polyps, any surgeries or anything on your nose?
No, ma'am.
Gotcha. Okay, I'm just going to take the pen light and look inside your nose for you. Make sure there's no obstructions. Say ah. Gotcha. Okay. Now I'm going to touch your gag reflexes. The tube is going to go down your nose. You might feel a little cough. That's normal. Okay. Cough for me. Cough for me. Gotcha. Okay. At this point, I would assess your lung sounds. So make sure there's no obstructions within the airway. Gotcha. Everything seems clear. I'm gonna put on my clean gloves. Gotcha. Now that I have on my clean gloves, we're going to take this tube. This is the tube we're going to be using today. We're going to use this tip part to insert down your nose, through the back of your throat. You'll tilt your head back for me, and we'll insert it. Before we begin, we're going to measure how long the tube should be. So I'll start at your nose, place it on your ear. That is the first length. Then we're going to take that part, bring it all the way down to the xiphoid process. Gotcha. Give you a few extra inches for any obstructions. I'm going to use my marker to mark. I will do. I have the red dot to indicate how far down to go. Okay. Before I begin, can you take a sip of water for me?
Yes, ma'am.
Gotcha. Make sure your throat is lubricated. It's going to be a little bit uncomfortable. Is that okay?
Yes, ma'am.
Then I'm going to use my lubricant to lubricate the tip of the tube for easier passage. Alright, now that the tube is lubricated, can you tilt your head back for me? There. Gonna go all the way down your throat. It's normal to feel a little cough or any type of resistance. It's normal. Gotcha. Now I'm gonna use the tape to hold it in place. Put one strip here. Then another strip this way, diagonally, to hold it into place. Now that the tube is in, now I would fill up my container for feeding, fill up my syringe, put it into the opening, push it all the way down for feeding. Then I will close off the entrance, tie it down to your gown right here. I will strap it down here and leave it there for placement. At this point, I will assess your bowel sounds again to make sure everything's okay. Okay, everything seems to be fine, no obstructions in the airway. Okay, and once the tube is in place, when you come back into the hospital, I will reassess everything, perform hand hygienes again. Did you have any discomfort while with the feeding tube that you noticed?
No, ma'am.
Any nosebleeds? Notice any polyps? No discomfort at all? Okay, and for removing the nasal tube, we will take the one piece of tape off. I would do it lightly. Make sure we're not pulling off any skin or anything. Gotcha. I will displace all of this into the biohazard container, away from the sterile environment. Peel off this piece. Dispose of it to the biohazard container. Look, tilt your head back for me. Carrie's gonna pull it off. Then remove the clamp from the gown. Can you cough for me? Okay, airway seems appropriate. We'll then take the nasal tube and dispose of it into the appropriate area. Do you have any questions for me or anything?
No, ma'am.
I would then take off my gloves and dispose of them into the biohazard area as well. Thank you.